So I'm the director of the Division of Services and Intervention Research at NIMH. And as the name implies, my research portfolio is organized around research that will improve the scope and the efficacy of interventions for mental illness, and then methods for organizing services to increase the number of people who receive evidence-based care and are able to benefit from those interventions. So since 2008, we funded the Recovery After an Initial Schizophrenia Episode project, which was designed to answer the questions whether early intervention services would be feasible in the United States, whether they would be effective, and whether they could be brought to scale or made available to the country at large. And 8 years later, the results of that research have shown us that yes, it is feasible. We can implement these kinds of specialty services in real-world community clinic settings in the United States using the existing workforce that are retrained for this specific purpose, that the services are highly engaging to young people who are candidates, so that being people with first episode psychosis, that they are effective and in fact superior to typical care in terms of improving symptoms, restoring vocational and academic functioning, and improving quality of life. Well, I think from our research project that I mentioned, the Recovery After Initial Schizophrenia Episode, or RAISE project, we learned something very important. We learned that people do much better when offered this kind of specialty care. But we also learned, importantly, that the impact of that care is magnified the shorter the duration of untreated psychosis. So if we get there early and we do the right things, we can expect a very strong, robust effect on the recovery outcomes that we look for. So it's good to do the right things, and it's good to do the right thing. It's good to do things at the right time. But I think the thing that is really critical for us to know is that it is absolutely critical to do the right things at the right time. If we can get timing and the quality of the interventions matched up, we really can bend the curve on what we can expect for trajectories in early psychosis. If we said that we're going to withhold treatment until the time that you have a stage 4 disease, people would say this is crazy. We have ways of identifying people much earlier, and we know that intervening early can really change the outcomes dramatically in the course of the progression of cancer. Well, we're at a place now with early serious mental illness, psychosis in particular, where we can we're not quite as far along as cancer, but certainly with first episode psychosis and the clinical high-risk criteria, we can identify people who are at very high risk for having adverse outcomes. And now we have tools available to us that we can offer at those early stages and really preventing them from getting to stage 4.